Charlie and this is my practical simulation. I've come in and organised the gym for the program today, and lucky we're a private studio so there are no other gym users to consider. I have tested all the equipment and removed all hazards when it's safe and hazard free. Hi, I'm Charlie and I'll be your trainer. Today's plan is fitness testing, cardio, strength and circuit. Now, I know your name and number, but I just need to ask a few more questions so I can learn a bit more about you. Are you over 45?
No.
And are you on any medication at the moment?
No.
And any infections or anything?
No.
Obviously you haven't had a baby recently, and do you smoke?
No.
And have you been in hospital recently?
No.
Any stomach ulcers?
No.
Epilepsy?
No.
Gout?
No.
Stroke? Diabetes?
No. No.
Pain in the chest?
No.
High or low cholesterol at the moment?
No.
Any heart murmurs?
No.
Suffer any dizziness or faintness?
No.
High or low blood pressure?
No.
Very healthy. Any arthritis?
No.
And now can you think of anything that will affect your training today?
Not at all.
You're healthy? Do you have any recurring injuries or anything like that?
No.
Fantastic, you're very healthy. Alright Renee, just a few more questions. Have you exercised in the past?
Yes.
Cool. What exercise have you done?
Gym and sport, and I have an active job.
And what type of sport?
Football, tennis, squash, but a bit of surfing.
And what exercise do you prefer? Do you prefer to exercise outside, inside, or what do you enjoy?
I enjoy working out in the gym and also being outside.
Cool. So what are your fitness short-term goals?
Well, I'm already pretty fit, so I'd just like to get more toned.
More toned? Any long-term goals? Did you want to
To
run
stay
a marathon?
No.
Or did you
No.
want to compete in Tough Mudder? Anything like that that would be long-term?
No, just that general fitness, as part of my already healthy lifestyle.
Cool. Right, let's get started. We're going to do let's get started. First of all, we're going to do the push-up test. This is to test how strong your upper body is. I know you're a fit man, so you've done them before, but I'm just going to show you how I want you to do the push-up, and then I'll do it once, and then you can do it as many times as you can without losing form. So I'll just show you how.
Excellent.
So come down, have your arms, shoulders under your arms. 1 and 4 days. Yep, your hands are in a great position. Now if you get up onto your feet, now drop down, you from here, keep your back straight, and 1, 2. Now keep going until you feel that you've done as many as you possibly can without losing form. All the way down. Great work. Keep your back down. Push up through your hands. Right, starting to lose form now, so that's enough. How many did you do?
30.
Good work. 30 push-ups. That is well above average. Average is 13, so you're in the exceptional amount. Great work. Now we're going to do a dumbbell chest press. Now it works better because you're stabilizing muscles, so it works better than just doing it with the bar. Right, so I'm going to demonstrate how to do it, and then you can have a turn after me. So, sit on the bench, come down, start with the dumbbells at the top. Now bring it down, and don't go below your shoulders, so just to there, and then push back up, and then back down.
Okay.
Right. Now, your turn. Right. Go. Now hold pump them up. There you go. So push up, yep. Shoulder width apart, down, and then back up. Great work. Down. Not too far, make sure you only go to 90 degrees.
Okay.
Yep, perfect, and push back up. Now the main muscles that this is affecting are your biceps, your triceps, your delts. Right, great work. That's enough. Fantastic. Yeah, let me take those for you. Stop. Right, great work there. Now the main muscles this is working are the chest, the pectoral muscles, the clavicle. It is also working the shoulders and triceps. When you use dumbbells, you maximize muscle fibers because extra muscle needed for stabilizing and balancing. Great work. There you go, done. Demonstrate a one arm row. Now we're going to use it on both sides, but I'll just show you on the one side. Right, so you need to put your knee like that. And there, you want to have your back nice and straight. Then you need to keep the elbow level with the torso. Now keep elbow stationary arm slightly bent, the shoulder blades back and fingers wrapping around the edge of the bench to reduce the strain on wrist. The exercising arm hangs vertically to the side and the palm facing the torso. The elbow bends, bringing the dumbbell up into the rib cage. Remember to switch on the core. Now pull up to your chest and slowly back down. This is working the whole lat, the upper back, the track muscles, posterior deltoids, biceps, brachia and latius dorsi and rhombus. Squeeze the shoulder at the top and keep the core engaged. There you go. Your turn. Great. Keep the back flat. Now bring up to the rib cage and down. Great work. And try to squeeze my finger as you come up. Great. How does that feel now?
I feel the burn.
Great. Now this is a compound exercise because it's using more than two joints. So it's working here in the elbow joint, the clavicle, and that one. I'll just try that one again. Hold on.
So should I stop this?
Yeah. Hold that core in and bring it up to your rib cage and slowly back down. Now this is using your shoulder, scapula and elbow joints, so it's a compound exercise. Right, let's do the other side. Pull this side down. Yep, perfect. Right, now keep that back straight, pull the shoulder up, squeeze my finger in here. Great work, and slowly back down. Just to there, yep, perfect. Then down. Then squeeze. Great work. Alright, that's that side done as well. Perfect. Now we're going to do the lunges. Now we want to stand shoulder width apart. Now take a step forward. So if I just take a step forward here, you take a step forward. Now go down straight, down. Great, now you don't want, let's do it again. We're going to do lunges. Now we're going to stand shoulder width apart. I'll show you first, and so then follow after me. Right, so stand shoulder width apart, step forward, and then now go straight down. Making sure that this knee does not come in front of the toes. Then back up, step back, and then step forward with the other foot, straight down, squeeze the glutes on the way up, and then back. Right, so here we go, your turn. Step forward, perfect, straight down, and up. Now the other leg, forward, straight down, making sure that the knee doesn't go past the toes. Straight down, and up. Straight down. Now this is working the quads, the hamstrings, the calves, and the glutes. Remember to squeeze the butt on the way up. Squeeze, great work. You're doing good. One more. Perfect. This is going to be how you use a treadmill. Obviously you've probably used a treadmill before, but I'm just going to go through it with you. Right, so if you just come up onto the treadmill, fantastic. Now this here is the safety feature. If you go too fast or set yourself up too fast, just pull that and you'll clip that onto your shorts so that if you fall off or anything like that, the treadmill will automatically stop going. So now we're going to push the on button for the treadmill, and then we're going to go with the quick start. Then we'll just select the speed that we want, and also the incline here. If you want to work on your endurance, use a lower speed, but use it. Hold on, stop there. Right, fantastic. Now, if you're working on endurance, use a lower speed like you're using at the moment, but do it for a long period of time. That'll help get up your endurance training. And if you want to increase your explosiveness through interval training, this is going as fast as you can, but only for a short amount of time. So let's try to speed things up a bit there. Fantastic, you're going really fast. Good work. Keep going. Right, there. We'll just slow that down again. And then you go slow for 30 seconds. And then we're going to go fast for 30 seconds. And that's the interval training. Right, 2 minutes later. Now this is a spin bike. First of all, we need to check that the seat's at the right height. So if you stand by the seat, fantastic. Hit your hip side. Now, if you get on, making sure that you put your feet into the cradles carefully. Yep. Fantastic. Now we'll just make sure that you're in nice and tight there. Hold on. Now spin bikes don't have the brake, so they can take a little bit slower to turn, but if you need to stop, pull back. Just check that the straps are in tight there for you. Cool. Yep, that's as high as it can go. Make sure they're secure. And yep, that one here. Now spin bikes don't have any other brake other than this one here. So if you feel that you're going too fast, just try slow the momentum down and use this here. Right, so you can use the grip that's more comfortable for you. You can be standing upright with the back straight and ride. How does that feel?
Good.
Cool. Now you can also have your hands resting on the pads here. There you go. Great. Now if you just keep going like that, or did you prefer holding on to the sides here? Which one do you prefer?
I like this one.
You like that one? Alright, fantastic. And you keep going like that for 5 minutes. And that's how you use a spin bike. Stop. Now we're going to do a boxing circuit. You've got your gloves on, fantastic. These are the pads. Now I want you to hit 1, 2. Right, go again. Good work. Keep going. Good work. Keep going. Right. Now we're going to get into... Right, stop there. That's enough. Right, now I'm going to work on your hooks. So, punch there, then punch there. Good work. Okay, can we still box it? Now I'm going to hold the pads, and you just go 1, 2, hit with your left and then your right. Alright, ready? Go. Good work. Keep it up. Yep, now make sure you bring them back up to your face. You want to keep your face protected. Good work. Now talk to the floor and make sure that you keep them up. Good work. Good work. Right, now we're going to do hooks. So, hit this one, then hit this one here. Ready? Go. Right. Remember, swing with your weight. Good work. Keep going. Good work. Good work. we're going to do uppercuts now. So make sure you go down and then go up. Good work. Right, now let's use some combos. It's going to be 1, 2, 3, 4, which is going to be left, right, hook, then uppercut. Right, ready, set, go. Great work. Go again. Good work. Right, that was the end of our boxing circuit. That's the end of our boxing circuit. How did you find that?
Great, really got my heart racing.
Awesome. Right, you're getting really good with your combos there in the end. Fantastic. How was your training today? Did you enjoy all the work that we did?
Yes, I did.
Fantastic. What were your favourite parts?
I enjoyed the weights and the boxing, but I think I have some more practice to do on the lunges.
Yep, that's great. At least you know that we can work on that together. And also you did a great job with your push-ups, so don't forget that you did a good job then.
Thank you.
So we're just going to work on your technique for your lunges, and yeah, anything else that you preferred?
No, I just think there's lots to build on.
Lots to build on. Fantastic. All right. Well, thank you very much. That was my simulation. Right, now with people with special populations and how we would change that workout. Hypertension, which is high blood pressure. Exercising can lower blood pressure, and it's very important to warm up and cool down. So making sure that you've got a good set warm up and a cool down. Now it's better to lift a lighter weight but with more reps rather than going heavier and doing less reps. Need to check whether the client is on beta blockers, as the heart rate may not be telling the full story about how much work the body's going through. And exercise where you can breathe comfortably and rhythmically, and avoid limbs going above the head, whether it be the arms or the legs. And the second special population are people with lower back pain, and how I would change that workout to suit them. Now, depending on what the back pain is caused by, but most lower back pain is caused by lack of core strength. You want to strengthen the core then and stretch the abdominal, hip and lower back. Try leg raises to strengthen stomach and hip muscles. Also wall slides up and down and hold for 5 seconds, then back up. And definitely avoiding deadlifts and squats would only be used using a fit ball. You would have the fit ball, you'd have the fit ball just against the wall for doing your squats. So that's how I would deal with special populations of people with lower back pain and also having hypertension.